we have found that when it comes to developing, interventions and things to address substance use, it really is um, like a multifaceted issue. You can't just address substance use. You also have to address mental health. You also have to address, you know, risky sexual behaviors. We did find recently that, when screening for HIV, you should maybe also screen for substance use because these things happen. They're sort of co-occurring. So I think that's one of the most interesting kind of in terms of the intervention piece is that, when screening for substance use, you should also screen for mental health. When screening for mental health, you should also screen for substance use.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Sitara Weerakoon, PhD, MPH. Sitara is a statistical and behavioral epidemiologist. She is an associate research scientist in the Substances and Sexual Health Lab at the Yale School of Public Health and co-founder of Donuts and Data, an online platform sharing all things epidemiology and statistics. And this is a bit of a follow-up from our original interview in episode 15. Sitara conferred a Bachelor of Public Health and French from Austin College in Texas, a Master of Public Health in Epidemiology from the University of Texas Health Science Center at Houston, Texas, and a PhD in Epidemiology also from the University of Texas Health Science Center at Houston, Texas. In today's episode, you'll hear and learn more about Sitara's journey as a behavioral epidemiologist, focusing on substance misuse and mental health among teens, the value she learned about academia through engaging in postdoctoral research, tips for research writing, and the rewarding process of writing papers that contribute to knowledge growth of a certain topic area, how publicly available data can be a valuable resource for research, her thought process for thinking through her next steps in academia versus industry roles, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Dr. Sitara Weerakoon. I'm an associate research scientist, and you are listening to Public Health Careers.
Sitara, welcome back to the show. Super, super excited to have you on here.
Thank you. I'm so excited to be here again.
I know, as we were talking about before, you were on episode 15. This is probably going to be episode 210s somewhere. And I'm just really appreciative for you. I don't know, believing in me, wanting to be interviewed early on and now being a part of this podcast and sharing your story.
Yeah, thank you. I'm just grateful that we've both kind of been in this journey at the same time for so long. So thank you for having me.
Yeah, truly, truly is my pleasure. And and I guess if anyone does want to check that out, I will link the show notes for the last episode that we did below, episode 15, as I said. But before we get into maybe some of that background and a little bit more about your journey, would love to hear how do you identify and tell us a little bit about your personal background.
So I am an associate research scientist at Yale School of Public Health. What that really means is it's a non-tenure track faculty position or research faculty. And my background is in broadly, public health. I have a Bachelor of Arts in Public Health, a Master of Public Health in Epidemiology, and a PhD where I studied epidemiology and biostatistics. And now I do what I call behavioral epidemiology, or kind of in the social and behavioral sciences, specifically related to substance use and mental health among teens.
And on that, so behavioral epidemiologist, firstly, what is that? And then how did you kind of get on the path to wanting to become a behavioral epidemiologist?
Yeah, so what is that? It's, when we think of epidemiology, people typically think of things like infectious diseases. COVID is a big one, the flu, kind of tracking like diseases in the community. And so behavioral epidemiologist is exactly that, but instead of infectious diseases, we look at conditions and behaviors related to human health. So, substance use is one of them. It's something that can impact your health in a lot of ways, but it's not necessarily an infectious disease necessarily. And how I got into it was I was always interested in human behavior and how that impacts our health. And so that led me to the behavioral sciences of public health. There's different domains of public health, biostats, behavioral science, community health, etc. but I really liked the epidemiological methods and the research methods that epidemiologists use. And so there's a whole section of epidemiology that's dedicated to the social and behavioral sciences, which is cool. So it's kind of like the merging of the two domains of public health.
And maybe, yeah, well, thank you for sharing that. That's very helpful for anyone that might be thinking about going down that path. So you mentioned substance misuse. Are there other topics that kind of come up, and maybe on the substance misuse path, like what are some interesting things that stand out as a behavioral epidemiologist?
Yeah, so that's a great question because originally I was interested in kind of only substance use as my behavior or condition that I'm studying, but in the population that I look at, teens or adolescents or youth, there's all these co-occurring behaviors and conditions that are happening, like mental health. So substance use and mental health often co-occur. It's really hard to piece apart like which happens first if teens are struggling with their mental health and are turning to substance use, or they're engaging in substance use kind of recreationally and it's impacting their mental health. So those two things are, mental health sort of came about in an unintentional way. I started looking at that. And then, related to that, a lot of like risky sexual behaviors is something that comes up a lot when I study substance use among this population. HIV and AIDS is something that I've been really getting into because it really co-occurs with a lot of the things that we're looking at. And different, risk and protective factors like where you live, what your environment looks like, who your social networks are, how supportive or not unsupportive, but what your family unit looks like. It's just a wide array of things that impact substance use and come up as I do my research. And to answer your question about what's something that stood out to me, I think some of the most fascinating work that I've done is related to the pandemic and how substance use behaviors have changed during the pandemic. So what we've seen is that among teens, substance use decreased significantly when everybody went home and was kind of in the lockdown period. And those behaviors have, for the most part, kind of sustained. Like we've seen lower rates of substance use. We have seen a lot higher rates of poor mental health, a lot higher rates of depression and anxiety, unfortunately. But it's interesting, the substance use behaviors have really kind of declined in the immediate years of the pandemic. However, it's interesting, the teens that are currently using substances are now using at a higher rate. So while the overall rates are lower, those who are using more. So, not necessarily the best news all around, but it is really fascinating and something I want to keep looking at.
Yeah, and as you're keeping looking at that and thinking about that, like I guess maybe like first impressions, you're doing a lot of work with this population. Like what are maybe some of the downstream impacts of a change like this, and understanding that change?
So that's, there's I like that you said downstream. There's a lot of changes that can be made at all levels of this. Like part of the research that we're doing is preventative. We're trying to develop an intervention for youth living in Paterson, New Jersey specifically. But there's stuff that we can kind of apply at every like stage of, I guess, substance use. And at this stage, in relation to what I'm looking at, I myself don't have any necessary like specific solutions. I'm still in the process of kind of understanding the issue. But we have found that when it comes to developing, interventions and things to address substance use, it really is um, like a multifaceted issue. You can't just address substance use. You also have to address mental health. You also have to address, you know, risky sexual behaviors. We did find recently that, when screening for HIV, you should maybe also screen for substance use because these things happen. They're sort of co-occurring. So I think that's one of the most interesting kind of in terms of the intervention piece is that, when screening for substance use, you should also screen for mental health. When screening for mental health, you should also screen for substance use. I think that actually is probably the most compelling thing that we found is that if you do screen for mental health, which happens more frequently than we would think, I think a lot of times when you attend or like go to a doctor's visit, they get like an anxiety screener. But I think that would be a critical place to also screen for substance use.
I appreciate that, and kind of just goes back to showing the interconnectedness of, I guess, issues that we look at and how these topics aren't really, they're not siloed. People
Mhm.
deal with different issues all the times, and those things might show up in different ways. So it's how when we are trying to find out the needs of people, we're doing a broader brush as possible to kind of understand what all those different factors are that we have to take
Mhm.
into consideration.
Yeah, yeah, definitely.
Pivoting a little bit now. So when we first initially spoke, we spoke in 2020, 22, no, definitely 2020 or
Mhm.
2021, one of those 2 years. And it was the beginning of donuts and data on Instagram and sharing data. You have since graduated from your PhD program. Tell us what has been the impact that you've seen of having a public profile to share information about your journey as well as other things that you're learning.
That's a great question. I think, it's made it so yeah, I finished so we yeah, our interview was in or our yeah, our talk was in 2020 and then I finished in 2022 and now it's 2024. So a lot has happened. Our accounts have both grown so much and I think having a kind of a public profile or platform along the way has been really like, not only educational for my followers, because I think I've grown a lot in terms of what I share and what advice that I give and what perspective that I have, but it also for me, it's been informative and educational for me learning about um, what I want to share and what like, what it's been a very like reflective experience for me because I am constantly pushed and challenged to reflect on my journey and what I would have done differently or what I wish I would have known, because I'm always thinking about, what can I share with everybody. I think that piece has been like the most helpful, for me is constantly being challenged to like reflect on my journey and also just really think like meaningfully about what steps I take next because it does at sometimes feels like there are eyes on me in some ways. Like I'm not in any serious way. I'm not like a celebrity by any means, but I do know that people always love to reach out and ask for advice and ask, and I always just want to make sure that I'm staying true to myself and I'm doing what I believe in, and I'm doing things that I would feel proud to share. So, yeah.
And as you developed a brand and shared content online, how do you stay true to yourself? Maybe as you're developing as a professional, learning more about yourself and doing all that work.
Well, I think, specifically like I think about this in relation to my career because I always was wanting to pursue academia or an academic career. But recently I've sort of pivoted to being really open to pursuing an industry career. And so I've been so careful about, what I do share with my followers because I want to be very honest about that. And I don't want to mislead anybody or share information that's not true. And so just in terms of like making a pivot, a career change, like it's important to be honest. And it's important to give your perspective while also remaining kind of unbiased in a way. So yeah, I think this has been especially pertinent to me when in my decision to kind of pivot outside of academia and into a different field.
That's real, and I definitely feel that as because there's so many. I feel like people out there, so many perspectives, and oftentimes we kind of stray away from our authentic and original self, or maybe even say something that isn't necessarily what we 100% believe with, but we know it's what people would feel more comfortable with us saying.
Mm-hmm.
And
Mm-hmm.
yeah, I've been trying myself to try to get out that box and just like say the thing that I would say because that's what I think people really do want to hear, and we kind of censor ourselves sometimes.
Yeah, no, absolutely. Because I want to always make sure that the things that tell my friends and have conversations privately are the same things that I'm saying publicly. I never want to have a conversation with my friends and my colleagues and my mentors, and this is my experience and this is why I'm choosing to do this. But then I go online and actually, like, everyone should be following an academic path. Like, not necessarily. I really want to make sure that, and also the other thing is I want to make sure I do it when I'm comfortable doing it, because that's been a big piece for me. It's like, this is my personal life and my personal journey. So I'm making these decisions, I'm going through these struggles. And then once I'm ready, and then I want to be able to go on my public platform and say, this is why I did this. May not apply to you, but this was my experience.
Right, right, right. And as I'm saying this, I'm thinking about a post that I've been thinking about creating of like why I haven't gotten a doctoral degree. Because I think like that's just a perspective I feel like you don't see too much is people like saying, okay, this is why I'm not doing this, or at least at this moment. And
Yeah.
I think that's just what I'm trying to like just share more of that authentic self, like coming from what you're saying.
I think that would be really valuable to share, because I think a lot of people come to me with kind of that question, like, should I pursue a doctoral degree? Everyone's kind of telling me that I should, and I'm like, you really should think about that before you do it, because there's probably a lot more reasons not to do it than there are to do it. And it's not something you should just jump and do lightly. So,
Yes, I absolutely agree with that, and maybe we could talk more about that some other time for sure. And I feel like that was kind of the framing of the conversation that we had when we first spoke on the podcast. It was like hearing your perspective of choosing the PhD, and hearing Mia's perspective of not going that route. But I definitely think like all discourse is important, and as we've learned, as I've learned over these 200 and something episodes, like there's no right way, there's no one way, there's only the way that you choose to do the work, right?
yes, I love that so much.
I'm glad you do. I'm glad you do. I do want to ask more about the pivoting and like the thought process of academia to industry, but I will ask that in a little bit later on. Before we maybe transition to a little bit overview of your journey a little bit more, what does public health mean to you?
Public health, at one point I would have said, like, oh, public health is, just, where we eat, work, and play. And it's broadly related to social determinants of health, and just broadly like the health of the community and how we can improve the health of the community. But it's so much more nuanced than that. There's so much more to public health than just simply social determinants of health and community health. It's your kind of your like the community agency to be healthy. Like, it has to do with your ability as a community to improve both mentally and physically. Like, I feel like, when we just have these interventions, like, oh, let's go into the community and give them this, this app, or this, whatever, these like interventions to reduce their substance use, or to, help them exercise. Like, it's way more than that. It's how much they can live their life in a way that helps them make these decisions. Like, it's one thing to give someone an app to learn something, but how is their community, their built environment, the policies around them, how is it impacting their mind and their ability to feel like they can make changes? There's so much more that goes into it, and it's very much on a societal level that public health kind of exists, in my opinion. I don't know if that really makes sense, but
Yeah, that definitely does make sense. And as you were saying that, I just came across an ad on, I think it was either Facebook or Instagram, and it's actually really sad to think about. So it's an ad about like school shootings and them having some sort of like blinds to pull down to block the windows, and then there's a mechanism in the door so people can't get in. And then I'm really thinking about like this isn't addressing the issue here. Like this isn't addressing like the underlying cause of why we need safety in schools, and it just made me think about
exactly.
like why we need public health and like that public health lens, because you can create uh, a solution for a problem but it's not really treating the actual problem, if that kind of makes, like, I guess it makes sense.
Exactly.
Yeah, yeah.
Yeah, no, that's a perfect example. Like, it's not just putting a band-aid on something that's happening, but it's really getting to the root cause of it. But getting to the root cause of it. And I feel like that's a conversation that is hard for a lot of people to have, is like the true root causes of some of the issues that we face.
Yeah, and I think that also comes down to maybe people feeling lack of agency and knowing that it's something like above us, or like that there are systems here and like making us feel like we can't do anything about it. And that's one thing that is in North Carolina. We don't say social determinants of health; they say social drivers of health, because it's like, I don't know, they did a poll and people felt like their agency was taken out of it. And I think drivers and determinants, like just the way that we speak about things and how people see themselves in that, I think is important.
Yeah, no, that's a really good point. And actually that's a really good like kind of distinction to make. Determinants is a really harsh, word. It's like this is deciding this for you, and that's a really good point.
Yeah. So if you want to listen to Sitara's journey, as I said, you could find that link below. But can you just briefly walk us through your bachelor's into maybe 2020, when you were midway in your PhD program?
Yeah, so when I went to college, I was originally wanting to pursue something related to like pre-med or I was actually, it's funny, I was kind of like pre-dental also, pre-med, pre-dental, mostly because I just didn't know what else was out there and I just loved teeth. But anyway, that's not me. So I didn't know what to major in specifically, but I knew I was gonna kind of do like pre-health science. And I was taking a lot of classes that just were interesting to me, but didn't necessarily follow any specific major. Like they were all in different departments. And that was probably going to be a problem for me. But luckily, during my sophomore year of college, our school introduced a new major on campus, which was the public health major. And I still didn't know what that meant. But when they gave us the sheet of paper that had like the required courses, luckily, all the classes that I had taken so far were on that list. So it was almost like, okay, I have to major in this major, otherwise I won't graduate on time, is kind of what it was. And so I enrolled in the Fundamentals of Public Health course, which was going to be a new class on campus. And immediately I fell in love with the idea of like preventative health. So things like fluoride in our water, seat belts, like just having a name for things like that was really eye-opening for me. I thought that preventative health at the community level was making a much broader impact than kind of the clinical perspective of like one-on-one, sort of like you come to the doctor when you have a problem and then the doctor fixes it for you. So that really resonated with me, the public health perspective, and it was everything else after that was history. I was able to do an internship at a research center where it was a trauma and injury research center that specifically focused on child maltreatment, and it was a all women like kind of team. It was literally all women on the team, and they all had MPH degrees, and then a few of them had PhDs. And so just talking to them about how they got to where they were, hearing their perspectives about getting an MPH versus a PhD, I knew at that point that I wanted to get an MPH at the very least, but I still wasn't really sure if a PhD was for me. And so after I graduated college, I enrolled in an MPH program. And I chose Epi because my college public health professor had an Epi background. So again, it was just limited exposure at the time. I didn't really know much about other fields, but she had studied epidemiology, so I studied epidemiology. And because of her background in epi, I was exposed to epi research methods. And so that's where that piece comes in of like, oh, I still really like the epi research methods. Then in my MPH degree is when I learned about behavioral science. And that's when I started to realize that I was really interested in human behavior from an epidemiological kind of research methods perspective. So I did my MPH, and in my MPH, I started to do more research. That's when I really started to write papers and learn about research studies. And it was just such a like fun environment for me. I thought it was really fun to write papers. That's really my favorite thing about academia is writing papers. And I really just loved the idea of being like a professor and having a teaching and a research role. And so I decided that I would pursue the PhD. So then I applied for PhD programs. I knew I wanted to do epidemiology. And at this point, I also knew that I wanted a quantitative skills background. I really wanted to have a strong like skill set in quantitative analysis. And so I, even in my master's, but also in my PhD, I just was taking lots of like biostats courses. And so that's where we met in 2020 on your podcast. So at 2020, I was like halfway through, well, I guess I was like a third of the way through my PhD program. And yeah, so I can stop there.
Yeah, I appreciate that, and I definitely appreciate like the framing of um you choosing epi because that was the limited exposure that you've had, and I think like that is probably how most of us fall into public health and different disciplines in public health is the limited exposure that we have in there. And I think what is important to highlight is even though that there was a limited exposure, you did go in to get the epi, you were able to learn that there was this behavioral science part of things that also interested you, and you were able to kind of like have both of those skill sets, so like have those two focuses. And then you said in the PhD you wanted to get more of a quantitative focus. How did you come to that mindset of saying, okay, this is what I want to get more focused in my PhD?
Honestly, like in my master's program, because I was still kind of open to any career, I knew that the quantitative, like data, kind of the data analytics side was um, appealing for job, like in terms of getting a job. I knew that that's where just a lot of jobs were and a lot of like, I guess, well-paying jobs were. And so because of that is why I forced myself to kind of take quantitative classes. And then I realized that I actually loved it so much. I excelled at it. It was really fun to me to like look at these behavioral issues with a quantitative lens. It was like a game for me, like putting a puzzle together, like figuring out what kind of model to run. It just felt really good for me individually to like be good at something that's challenging. I think like up until then, there was a lot of things that were challenging for me academically, and I didn't always love it. I didn't always like thrive at it. And biostats was an area that was challenging, but I was also thriving in it. And so it just worked out that that was something that I originally pursued because of the career prospects, but then I ended up just falling in love with how I can apply that to the social and behavioral sciences. I think it's carried me, really far. I think I do appreciate the unique, like the unique perspective I have on applying the quantitative, like the quantitative methods to the behavioral sciences. That is so much fun to me.
Yeah, and I also like that take of you saying, okay, I'm getting this PhD. What are things that are gonna like be profitable or like be able to help me get a career where I can like sustain myself? And yeah, biostats is definitely probably at the top of that list. Anyone listening to this, highly recommend because you could just apply it to so many different um avenues in public health, outside of public health, and I think that with the public health perspective is helpful as well. Um, and and I guess I say that to say like I think it's better to go in with that. Okay, let me find something that's going to get me some sort of financial stability with a job prospect, and then I can find like passions and stuff like that. Thankfully for you, you were able to find that passion in that skill. That was the thing that you chose. But just putting that word out to people, like really think about, especially in today's world, I think like be intentional in thinking about what are the skill sets and what are the avenues and career trajectories that can come from those skill sets as you're developing your career.
Yeah, 100%.
You said that you love writing papers. Why do you love writing papers? And then I'm gonna ask you some more questions around papers since you got a lot of experience in this.
Yeah, so it's not just the writing papers piece. I love the like start to finish, like, obviously there's data collection, but even if you're not involved in the data collection piece, there's always secondary data analyses. So for me, like it kind of starts with putting together the research question, getting the data to answer that research question, putting together the analysis plan, analyzing the data, interpreting the results, putting together the paper, writing the paper. So to me, it's just, I don't know, it's just so much fun. I've actually never been asked that question. I've never had to think about why I like it, but I think it's, it feels, it feels like, even though I do find writing academic papers to be not problematic inherently, but like not a lot of people read them. There's a big gap between what's published in research and then what's put into practice. It takes like years for that to happen. So I don't think that writing papers is like the best way to get to be impactful, but I do find it to be an impactful experience. I do find it to be very like rewarding. Like, here is this data that we have, and here's this important question, and what are the findings? Like, you learn so much from this process of writing papers. But two, I do love to like write, and so that part is true. I love to write, and I love to it's just such a rewarding process, to be like, look at this thing that I did, and not just me, but like the whole team, right? It's a whole group of authors that are contributing, and look at this thing that we did together. Like, yeah, I don't know, that's just the best way I can describe it.
No, and what would be some of your biggest tips for people that are aspiring public health researchers and want to author papers?
I definitely recommend taking advantage of publicly available data. So, like, the CDC has a ton of surveys that they administer to all different types of populations, all different types of health topics. I use the YRBS so frequently, like insanely frequently. I publish with the YRBS a lot, but I think it's great. Like, I think it's amazing that there's all this data out there that's just ready for us to use. You don't even need to like be any type of professional. Like, you can be a student and you can go to the CDC website, you can download YRBS, and if you have the tools, like if you have SAS or SPSS or Stata, you yourself can just go in and kind of play with it and see what you find. So I think that would be my biggest tip, is to take advantage of publicly available data. That was what I did for my very first author publication that was related to my topic of research. My advisor sat me down and said, go download YRBS and think about a research question that is you're passionate about, and just lead that. She just kind of threw me into it, and I did that. And it was such a humongous learning experience for me as a first year PhD student. Um, and it just gave me a lot of agency to know that like this is something I can do, this is something I'm good at. And it like was, it contributed to the literature. It's been cited like by other scientists. So I think so I think taking advantage of that data and also doing it in a responsible way. Like, don't obviously go through all of the appropriate methods and peer review and all that, but I think there's so much publicly available data out there that you can learn from.
Love that. Love that. Yeah, definitely take advantage of that. And I feel like to your point, there's a lot of data out there. There's about what is the question that you're asking the data, and so many of us have so many different lived experiences that can help us, or an interest that could help us shape different questions and therefore different answers to the same data. So I'll
Mhm.
try to find some of those and link those below for anyone that might be interested in that. So you graduated from your PhD in 2022, and then you decided to pursue a postdoctoral research fellowship at Yale University School of Medicine. Tell us about that.
Yeah, so I knew that I wanted to do a postdoc because I was still wanting to pursue an academic career. And in the field of public health, and specifically in the field of epidemiology, you need to do a postdoc in order to be competitive for tenure track positions. So I knew that if that was something I wanted to do, then I would need to do a postdoc. So I was applying for different postdocs related to my topics of research: maternal and child health, youth substance use. Um, and I found, actually, my good friend Mike sent me a posting for a postdoc position in the SASH lab, which is where I am now. And I applied for it, I interviewed, and I got it. And then a few weeks later, she called me, and she was like, who would be my supervisor, she called me and she said that there was an opportunity to join a T32. So a T32 is a NIH funded training program. So it's basically different schools and programs around the country can apply for a T32 mechanism, which provides funds to train both predoctoral and postdoctoral students or trainees in basically everything related to academia. So grant writing, professional development, data analysis, whatever it is, whatever topic the T32 was in. So my T32 was a substance use prevention T32. So we did activities related to substance use research. And so, yeah, that's how I got into the T32, which was housed in the School of Medicine. It was such an incredible experience for me. I learned so much about navigating academia at an elite institution like Yale. It was really reflective for me to decide where it is I wanted to be, what I wanted to do, what was right for me. It was really instrumental in me kind of realizing that soft money positions, which are positions where you are responsible for the majority of your salary, which means grant writing, is like not really exactly where I want to be, because the grant writing is not something I particularly enjoy doing, nor is it really my strength. It's not, let me say this, it's not something I want to do to sustain my lifestyle. I don't want my life to be, what's the word? I don't want my livelihood to be dependent on grant writing. And so, being in the C32, which is like, we did seminars on grant writing, which were, very informative because we all had to write a grant from start to finish and share it with each other and get feedback from each other. It was just so helpful for me to learn that like having to do this in order to fund myself is just like not, this is not really what I want to do. And so, yeah, so it was amazing. I feel really grateful that I was able to get into that T32. And then, yeah, and then I can continue with my transition after postdoc. But yeah, that's to answer about my postdoc.
Yeah, I appreciate that, and like I can imagine how that transition could have been. And I think it's also interesting to look at it now, considering that you are on the line of pivoting and not going into academia, but going into industry. So maybe on that path, like would you still say that the postdoc was valuable for you as you're transitioning into industry, and like how so?
Yeah, okay, yeah. So I would say yes, it was still valuable because I was still getting research experience. So I actually did my PhD in 3 years, which is really short for, I mean, nobody really does a PhD. They're like famously known for being long programs. And so I did mine in 3 years, which was great. And it was like, I still enjoyed it and I have no regrets, but I still had a lot to learn in a few ways. And so the postdoc did provide me those extra years of training, of just learning about academia. And so I have like no regrets about doing it. It was still very valuable. Um, and two, like I am pivoting probably to industry, but I'm also open to like hard money academic positions. And so I still think the postdoc um, was valuable in that sense because it was still like an additional few years of training. But I will say, like, for doing an industry, you really don't need to do a postdoc. And so if I had decided to pivot to industry earlier, I may not have chosen to do a postdoc, but I don't necessarily regret doing it.
Understood. I didn't realize that you completed your PhD in 3 years. That's impressive. And I could also understand why that probably didn't give you as much time and flexibility to do all the things that you did want to do. And appreciate that reflection. You also shared that going for this postdoc allowed you to learn more about academia. Maybe what are some things that you learned that would be helpful for you to have known before, or some things that you tell people that are going into maybe postdocs or PhDs or just academia in general?
I think, there wasn't anything like specific that I learned. It was more just like the additional years in that environment that was helpful for me because like I said, I was 3 years in my PhD program. It was 2 years in my MPH, so 5 years of grad school in total. But two of those years was MPH, so it wasn't really like it really like an engaged like all in kind of thing. It was just the MPH program, which can vary for a lot of people in terms of how involved you are. So it was additional years of like really being in that academic setting. Um, and like I said, so my T32 was grant writing seminars, professional development seminars, and data analysis seminars. Um, I think that was like the main kind of activities that we did. And it was just really eye-opening to learn about soft money positions. Like Yale School of Medicine is a soft money school. So like everybody in a school of medicine has to like, obtain grants to fund their salary. Um, and I had known that, like I was aware of that, but I was like kind of like way more in it, I guess, if that makes sense. Like in grad school, I knew that some of my professors came from those institutions and a lot of them would get burnt out and it was just not sustainable. But being in an actual school of medicine and seeing kind of like being working close alongside professors that did have that requirement of them, I could see how much work it really was. And there's nothing against that. Like I think that's a like a great place to be. And I think that I have lots of friends that are going into that, and I admire a lot of the faculty that we did work with. It just wasn't a good fit for me personally. And so that was really eye opening. And yeah, I think, the other thing is that my T32 gave me a lot of grant writing experience because we did have to write a grant from kind of start to finish during the program. And so that was really good practice for me. I had written a grant previously. I did write an F31 mechanism when I was in grad school. And so this was kind of my like second experience with writing a grant. And it was just like reaffirmed to me that I just don't want this to be my livelihood. Like I just cannot, like it's just not a good fit for me. So those are the ways in which it kind of helped me make up my mind about which direction to go in.
Understandable. And I feel like it is that thing where we say like, oh yeah, I want to do this thing. Yeah, I know what all that takes. And then you're actually in the environment where you're getting to see people like one on one dealing with the benefits and the throwbacks, I guess the I don't know what the word is, the the fallbacks of that, and really seeing like, is this actually what I want to do, and realizing that it mightn't be something. And I'm leaning to it because I didn't realize there was a institutional difference between soft money and hard money. Um, and I could imagine, especially like, let's say you're in a soft money school and you're working on a very niche topic that you're passionate about. It might be much harder for you to get grant funding, and thinking about what does that look like sustainably, and all of that could really be considerations as you are wanting to do this kind of work. So
Mm-hmm.
definitely you're helping me to think through things that I haven't thought about, and I guess considerations when I'm talking to people who are thinking about PhD programs, and I guess academia in general. So I appreciate that.
Yeah, definitely. And I think the other piece of it is teaching too. Like I I really value teaching. I love teaching. And so it's just been about me like finding the balance of what I really like to do and what I can kind of how I can make my livelihood work with everything.
And then after your postdoc, you were an adjunct professor at Southern Connecticut State University, and you're currently an associate research scientist at Yale School of Public Health. So tell us about the transition, maybe out of your postdoc into these positions.
Yeah, so the adjunct professor is like what I just touched on about the teaching part because I love teaching and I wanted experience being like the primary like instructor of record versus I was a teaching assistant all throughout grad school. So I wanted to be like the actual professor or the teacher, if that makes sense. And so I was able to find an adjunct position at our local state university. And that's been so much fun to teach. I teach statistics, which I love. And that's just something I do like in the evenings. I teach statistics at Southern. And then, yeah, so the transition from postdoc to ARS was more of that, like, kind of, I don't necessarily want to apply for a tenure track position at this point. This was last year that I made this decision because that was my last year of postdoc. So, in my last year of postdoc, I was at a place where I needed to decide what my next step was. And I wasn't ready to apply for a tenure track position, but I also wasn't necessarily ready to like leave academia. It was really just like a indecisive moment where I was like, I don't want to commit to industry right now, but I don't want to commit to a tenure track position. So the ARS was like the perfect in between for me. It was kind of like I can stay in the lab that I'm currently in, I can keep doing the work that I'm doing, but I can make more money than a postdoc, right? Because I could have probably, well, I never considered it, but like it probably would have been an option to extend postdoc for another year, but that's not very financially, like postdocs don't make very much money. So it was just like a perfect in between. It actually was like the ARS, or the research faculty position, is kind of like ticks all my boxes because there's no grant writing involved. Well, not that there's no grant writing involved, but I don't have to write grants to sustain myself. But I do contribute to grant writing in our lab, which I'm very happy to do. I can lead all the quantitative analyses. It's just like I can contribute and collaborate with people. But now that I've been in this role and I'm going to be in this role for the next year, I think I am deciding that industry is probably the place that I want to be next. And so it's just been a lot of growth and a lot of learning for me along the way.
And walk us through that. Walk us through that change in perspective. And I feel like you kind of alluded to some of the things along the journey that made you make that pivot, but give us everything.
Well, I mean, like, I think one, I, if I can find a position, a hard money position, an academic role that it aligns with the things that I like to do and pays me the salary that I want, then I would take it. So it's like if I do find that, then I would be happy to take that. But I'm really just happy working kind of like a traditional job. Like that's what I've discovered with this ARS position, is that I do quantitative analyses every day. I do, general research related activities, and you can find those positions in industry and you get paid a lot more, to be frank. Like, unfortunately, academia doesn't pay a lot, unless you're like the PI. And so I just realized that a lot of the things that I'm doing now, I can do in an industry role and get paid more. And I also have been learning a lot about what is out there in industry. And I've been learning that through talking with some of my supervisors and some of my mentors, as well as talking to people that I know that do this work. And I've just learned a lot more about what's out there and what options there are. There's a lot of cool work in kind of the government adjacent world. So for example, there's the government does a lot of research, but they contract out private companies to do a lot of the research for them. And so that's a really big space that public health people can go into that I did not know about when I was in grad school. Like I was aware of it, but I didn't realize how much was out there and how much of it is related to what we do every single day. There's obviously like nonprofits. There's just a lot out there for people in the public health world that I've been learning about slowly, and I've realized that it's just very appealing to me. It's something that I love doing just as much as like it's still research, I guess is what I'm saying. Like it's still all research related, and that's really what I enjoy at the end of the day is the research. It's the quantitative methods, it's the program evaluation. Like all of those things exist outside of an academic space, and that's where I'm kind of opening my eyes. So like seeing what's out there and realizing that the pay is just a little bit better than it is in academia.
No, that's a reality and I appreciate you sharing that. And like as you say in academia, I'm thinking just broadly like local governmental public health because I think the skill set that someone with a public health degree, especially masters of public health and above, it could be so useful to so many different industries, to so many different companies. And I think about like your skill set specifically could be used in so many different places and I think we maybe in public health haven't had the vision for those positions or haven't understood where we can fit into those different industries. But as we continue, I think, to learn and develop in public health, we are seeing that there are so many ways to make an impact with the skill set that you have, whether you're in local government, academia, or in a private industry job.
Yeah, exactly. I think that's what I've learned is that our skills are so transferable in public health. And I think that that's not something that they necessarily tell us explicitly when we're in grad school. Not to anyone's like it's not necessarily anyone's fault, but I do think that that's something that should be kind of taught more, is that these skills can really be transferred outside of traditional public health areas.
Yeah, yeah, absolutely. And that this is something that I want to dig more into, because I think MPH programs originally started for like governmental public health specifically. So I can see why that kind of train of thought is there, as well as like the academia piece just naturally being there. But especially in the last 4 years or so, we've seen so many like public health just come to the forefront, and as well as people seeing the value for the public health skill set. And I think I'm gonna write a post about this at some point in time, but and I feel bad to say this, but it's gonna be very hard for governmental public health to catch up with what industry can afford
Right,
for people
right,
when they see the value and the skill set that we do have. So it's gonna
right.
be a ongoing battle for, I think, local public health, academia as well, potentially. But that's a larger conversation for sure.
Yeah, definitely.
So before we move you on to the Furious Five, love to know where can people connect with you, and I would love to hear maybe like a favorite. So maybe a favorite book, movie, I don't know, anything that's kind of like standing out as a favorite to you.
Oh my God, I wasn't prepared to answer that. Okay. Um, okay, well, actually, something just came to mind. So, you can connect with me on Instagram. My handle is at donuts, and well, it's donuts underscore and underscore data, and donuts is spelled the fancy way, DOUGHNUTS. And then I'm also on LinkedIn. I think maybe these will be linked, perhaps, but it's just under my name, Sitara Weerakoon. And right now, my favorite book is Homegoing. I just read it earlier this year. It's such an incredibly written book. I don't want to give too much away, but I just love the format of like being able to like take a step back and like view history from like a bird's eye view. That's all I'm gonna say. I really love that book. Um, and my favorite, well, I don't know. I can share more favorites.
Please.
My favorite two albums right now was Billie Eilish's latest album, Hit Me Hard and Soft, and then I was looking at my like Spotify stats the other day, and I was realizing that I think my favorite album of all time is Heroes and Villains, because it's Metro Boomin's Heroes and Villains, because my top like six songs, like most streamed songs of like my lifetime, are all from that album,
I
which is
love
like
that.
maybe embarrassing, I don't know, but those are my favorite.
I love that. I love that. And I think it's important to kind of highlight things outside of the public health realm. So I appreciate
Definitely.
you sharing those. So moving us on. So the Furious Five, 5 questions I ask all guests. I think these have changed. Well, I don't think they have definitely changed since we last spoke. But I think the sentiment remains the same. Number one, what advice would you give to a student trying to pursue a career in public health?
I would say, like always, I would say, really keep in mind why your why. Like, why are you doing this? I used to always say, like, when I was in college and grad school, like, write down like why you're doing this. What is that? What exactly do you want for yourself? What exactly do you want, the impact that you want to make, if that's how you're looking at it? And then just keep reflecting on that as you continue throughout your career. Like, are you still doing things that align with your why? Has your why changed? I think it will really help you make decisions when you feel indecisive about where it is you want, wherever you want.
Number two, if you are talking to someone wanting to get into your position, what advice would you give them?
Oh, I would say, oh, so if I were to give advice to someone wanting to get in my position, I think I would say there's just so many different like avenues of Like, why? Oh my goodness, I wasn't prepared for this one. Okay. I think the advice I would give is to, okay. I think my advice would be to, and I'm going to speak actually about both postdoc and ARS.
Hmm.
And I'm going to say my advice would be to really prioritize yourself and make sure that you're still pursuing your interests and your passions, and you are maintaining hobbies, and you have a very like a work-life balance. Like I would say maintaining a work-life balance is such a like cliche. It's not a cliche, but it just feels like a phrase that people just throw out there. But like I'm so serious. Like make sure that you're prioritizing your identity outside of your work or your research, because it's so important that you know who you are and what your interests are outside of what you do for work, because at the end of the day it is just work. And I would say that that advice actually extends to grad students as well, even though it can be harder because grad school is more than work. But at the end of the day, like there is more to you outside of grad school.
Love that. Number three, what's something you're working on improving in your life right now?
My hobbies, that's something I'm working on, kind of brand like figuring out what exactly my hobbies are, because I will say like I was always pretty good at balancing who I was outside of grad school and outside of work, but I didn't really have time for like travel was really the primary thing that I did outside of work, and it kept a really good work-life balance. But outside of that, I really didn't have any specific hobbies, and so I'm really trying to figure out what I have time for, what my passions are, what I'm good at. Yeah.
And I guess on the line of travel, I know you've been to a multitude of places. What is your favorite place at the moment?
At the moment, so it always changes because every time I go to a new place, I then fall in love with that place. But right now, it is so right now I would say it's Norway and Tanzania. So I just got back from a trip to Tanzania, and it was so incredible. It was so beautiful. There's so many different types of like landscapes, and there's just a like there's the safari, there's the city, and then there's Zanzibar, and so it was just really beautiful to be in these different spaces. Um, I really enjoyed it, and then Norway was incredible because I got to see the northern lights, and it was just we were up in the Arctic Circle for some time, and it was just so peaceful. And so yeah, those two would be my two current favorites.
Well, thank you. And I will definitely have to add those to my travel list for sometime soon. Number four, professionally, do you recommend anything?
That's okay. Professionally, I don't know if this is the way that you're asking this question. I'm sure this is open-ended on purpose. But I recommend getting a computer that can handle large amounts of memory, because I'm realizing that okay, this is from specifically the perspective of someone who does a lot of statistics and a lot of analyses, is that um, I used to just really want like a cutesy little small computer, and I just am realizing that for the amount of stuff that I run, like I really just need a more powerful computer. And so professionally, I recommend investing in a good computer.
That's actually very real. The data and learning and impact person at my organization has a specific computer. Everyone else has the same computer, and then she has like an upgraded version. Because yeah, it definitely is important, and just makes life a lot easier if your
Yeah.
computer's not like lagging heavily. So
Yes.
awesome. And then last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
It would be to just okay, like my advice is always just everything will always work out. Like that's what I would tell my younger self. Um don't spend too much time worrying about whether you're making the right decision, because the right decision is the decision that you make. And so it can feel so so stressful and so like just anxiety ridden to make these decisions when you're younger, but everything will work out and every decision that you make is the right decision. So that would be the advice I would share.
Dr. Sitara Weerakoon, thank you so much for coming on and sharing your expertise once again. Love talking with you and look forward to continuing this conversation and this relationship.
Thank you so much. Thank you for having me, Omar. It's been a pleasure. And yeah, definitely looking forward to doing this again.
Yeah, hopefully not in 4 years' time. We'll definitely
Yes.
look around and do it sooner.
Hopefully.
Yeah. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to hit that subscribe button if you have not as yet. Leave a 5-star review and share it with a friend. Greatly, greatly appreciate you all and see you all next week. Peace, everyone.